Oh, I do it in 3 to 4 weeks.
Okay.
And I get them right on the Eucrisa.
Okay.
But there are people that, you mean, everybody's not the same. So that you might have to come back in and be like, oh, you didn't work the Eucrisa. Let's try Elidel. Let's try Atopic. And then you put them back on maybe for a week or two and try to wean them onto that. There are newer forms of meds coming out all the time. If you don't have barrier repair for the skin, and your skin is the largest organ on your body, so you want to make sure you take care of it and don't lead to infection, or if you do break down the skin, let's say you're scratching out, you open up the skin, we have microbes, that pretty little microorganisms that live on our skin naturally, staph and strep, so you don't want them to all of a sudden turn on you either. You want that barrier to stay intact, because if not, allergens and pollutants also now enter the skin and break down and inflame the skin as well. There's also prescribed emollients like Episerum, Luxamed, Biofen. They're great for putting emulsion back into the skin as well for people who have a really hard time of getting that emulsion back in. Hyaluronic acid-based products are a great source as well.
Nice. Oh, we're learning so much on this. Hard to keep up with all this. So tell us, can you give us the ABCD approach, non-pharmacological interventions to atopic dermatitis? ABCD.
ABCD. So pretty much taking away fragrances, taking away allergens. Not every perfume is bad, but you don't want to spray it all over yourself. Some people, if they can get away with it, spray it on the clothes the night before. Like I said, we changed the products, we've changed the wash and all that. And then we start to let's go look at allergies. What are your basis of your allergies? A lot of people, especially in our community, don't visit allergists. Go to an allergist and see, instead of trying to guess what you need to avoid. And it's not just seasonal allergies or environmental pollutants. You also want to be able to take away like certain products that you might be allergic to that you didn't know. It's not that every woman can't do mascara, but you can't do a mascara that has Quaternion 15 in it. So you have to figure out what that is.
And will an allergist be able to tell?
Absolutely, especially with patch testing and Ross testing, where they do prick needles into the skin to see what you react to. But I mean, like I said, it's different based on your community. Like for our community, going back to what we were talking about, well, is it race related? I look at the different things. Is it genetics that make ours worse, that makes it more prevalent? Genetics, environmental causes, like pretty much, what do you call that? Race inhibited kind of diagnosis in medicine, and pretty much where people live. So the shortcomings on, okay, so if I live in a place that has more environmental pollutants, does that mean that I'm going to have more pollutants? Yes, it is. If I'm not taught that I need to avoid certain allergens, yes, it is. So all those things that you have to take into consideration.